Hello. So today I am going to talk about noise induced hearing loss. So many times people who works in noisy places like factory workers, traffic police, bus driver, or there are certain group of population, especially youngsters, who visit a DJ and who regularly visit pubs where you can find a very high amount of sound, a very high intensity of sound. So all these population, either who works in noisy places or who have noisy hobbies, as I told you. So these populations are at high risk of noise induced hearing loss. So now I'm going to why we should bother uh, for this particular type of problem, that is noise induced hearing loss. Why it's a high time to think on this, because many times patients uh, comes to us and they complain of a hearing loss, and when we do audiological evaluations we get certain findings on pure tone audiometry as well as in our other tests like autoacoustic emission. So ultimately, uh, based on the case history as well as audiological evaluation, to some patients we diagnose them as they are suffering from noise-induced hearing loss. And when it comes to the treatment option for this kind of loss, then we don't have any kind of medicine or any ear surgery which can treat noise induced hearing loss. So there is a proverb, prevention is always better than cure. So it's a high time to make people aware about noise induced hearing loss. It's a high time to make uh, youngsters aware regarding noise induced hearing loss. So why I'm saying that there is no medicine and no surgery for such kind of hearing loss? There is a special type of hair cells in our cochlea. We say it as outer hair cells. And outer hair cells do not divide. So as we know that in our body we have cells and there is a process called cell division. So it's very common with the other kinds of cell. But the cells of hearing, or you can say the cells responsible for hearing, don't divide, and that's the reason of our concern, that when it do not divide, how our ear going to recover the loss caused by noise, or you can say high intensity of sound. So in that condition, we as an audiologist, we only have an option called hearing aid, and many times youngsters do not want to go for hearing aid, as the hearing aid can cause a social stigma, or they see hearing aid as a sign of some kind of disability. So in that case it's going to very difficult to counsel them and like convince them to go for a hearing aid. So the main purpose of making this video is to aware people about noise induced hearing loss. So whenever you are going in noisy places, like if you are going to some in a factory, or you are going to attend some DJ kind of thing, or you are going to attend pubs, or many times the marriage, even the marriage, like in the marriage and all, you can see a very high amount of sound at the site of, at the location or surrounding. So if you are visiting such kind of places, you should always try to locate at a place away from loudspeaker, away from crackers, or suppose if you are going for a satsang or a kirtan or some other religious kind of thing, so there also you should try to be away from loudspeaker as much you can. And suppose if you are a factory worker, or you are a traffic police or a bus driver or any kind of profession where you are getting exposed with a loud amount of sound. So in those situations you should take some kind of earplugs. So there are many kinds of earplugs available, and or you can put some amount of cotton in your ear. That will reduce the high intensity, that will reduce the intensity of sound. And when the sound reduce with from a particular level, that will be considered as a safe sound. So that's the reason, as an audiologist, I want to aware people regarding noise-induced hearing loss, and try to be away from noisy places. Try to avoid those situations where you are going to get exposed your ear from a noisy kind of source, like crackers or loudspeaker and all. So it's very important, as I told you earlier, that that the outer hair cell do not divide, so it don't have property to divide or repair itself. So it's always better to protect our ears. So now I'm going to present a case. So yesterday, a patient visited our hospital with a complaint of hearing loss. So when I did audiological evaluations like pure tone audiometry and tympanometry and reflexometry, so based on the finding, I suspected noise-induced hearing loss for him. So as per the case history, he had attended a marriage 1 year back, and where he got exposed with a loud amount of sound, like cracker sound as well as loudspeaker sound. And afterward he started feeling hearing trouble or problem in listening, especially in the crowded situations and all. And then after that, afterward also, he keep visiting kirtans and satsang, where again he got exposed with a loud amount of sound. So based on case history, I suspected noise induced hearing loss. And after audiological evaluations, I was 100% sure of noise induced hearing loss, as I observed 4 kilohertz, a dip at 4 kilohertz in the audiogram. And the tympanogram shows a type of tympanogram, and the reflexes were present. And if I talk about the degree of hearing loss, then he was having moderate hearing loss in left ear, and moderately severe hearing loss in his right ear. So, and that's of sensory neural type. So I was 100% sure of noise induced hearing loss. And then I discussed the treatment option for the same. He was not having tinnitus and other kind of issues, as we regularly see in the patients with noise induced hearing loss. He was not. आपको क्या दिक्कत है?
कान में सुनने में दिक्कत आ रही है।
सुनने में दिक्कत आ रही है। कब से दिक्कत आ रही है आपको?
साल हो गए।
1 साल से हो गए। तो आप कभी कोई ऐसे जगह गए थे जहाँ पे तेज आवाज हो या नॉइज हो, ऐसी जगह पे आप कहीं गए थे?
शादी में गया था जी।
शादी में गए थे? कब गए थे आप शादी में?
साल हो गया।
1 साल हो गया। तो शादी में जो गए थे वहां पे काफी तेज आवाज थी?
वहां मेरे को गोली वाले पटाखे चला रहे थे।
उससे वो लोग गोली वाले पटाखे चला रहे थे। और भी पटाखे चला रहे थे?
नहीं, बस गोली वाले
पटाखे चला रहे थे।
बंदूक वाले होते हैं।
बंदूक वाले पटाखे चला रहे थे। काफी आप उसके पास थे?
तो मैं तो ऐसे ही गुजर रहा था, वो बस चल रहे सभी
गुजर रहे थे। ओके। तो उस तब आपको एक कान में प्रॉब्लम हुई, दूसरी कान में प्रॉब्लम कब हुई?
दूसरे में मैं तो कीर्तन में गया था, सत्संग में।
कीर्तन में गए थे, वहां पे लाउड स्पीकर में काफी हाई वॉल्यूम में सत्संग चल रहा होगा।
बाहर ही उन्होंने लगा रखे थे,
बाहर ही लगा रखे थे
उसमें बस।
तो जैसे कि मैंने आपको बताया कि ये जो आपकी जो दिक्कत हुई है ये परमानेंट हो गई है।
अच्छा।
ये परमानेंट लॉस इसे हम बोलते हैं कि जितनी दिक्कत आपकी हो गई है वो उतनी हो गई है। तो अभी आपको ये दिक्कत हुई है, तो अभी आपको क्या लग रहा है कि बाकी लोग हैं उन्हें आप क्या बोलना चाहेंगे आप अपने तरफ से?
मैं तो बचाव ही कहूंगा, उनको बचाव किया जाए
कि लाउड साउंड से उन्हें बचना
बचाव,
चाहिए।
और जो कर रहे हैं वो भी
उनको भी
ध्यान
मना
हाँ
करेंगे
हाँ
कि
बंद
आप
करें।
जो शादी में जो फटाके
हाँ जी,
इतना चलाते
हाँ
हैं
जी,
और इतने ज्यादा लाउड स्पीकर में इतनी तेज आवाज
हाँ
होती
जी,
है, उनसे बचने की जरूरत
हाँ
है।
जी,
या
बचने
आप कभी सत्संग में जाते
हाँ
हैं या
जी,
कीर्तन में जाते हैं,
हाँ जी,
वहां भी लाउड स्पीकर से में जो तेज आवाज आती है उसके पास नहीं जाना है। अब जैसे कि आपने पहले भी बताया, मेरी से बात हुई कि जैसे कि मैंने आपको बताया कि बिल्कुल आप सत्संग जाइए, बिल्कुल आप कीर्तन कीजिए, या बिल्कुल आप शादी में जाइए, लेकिन जहां भी कोई तेज आवाज है, काफी जो लाउड साउंड
मैं
है,
पास नहीं गया था, आवाज ही बहुत तेज थी,
बहुत
जोर
तेज
था
आवाज
फिर
थी,
भी।
फिर भी वो आपको हुआ। तो देखिए यही होता है, अभी तो जिनकी शादी होनी थी वो तो हो गई, लेकिन आपको ये प्रॉब्लम हो गया। तो इसीलिए मैं अभी जो भी मेरे मेरे को सुन रहे हैं, जो भी मेरे ऑडियंस हैं, मैं उनसे यही कहना चाहूंगा कि आप जब भी किसी भी कोई फेस्टिवल में या किसी ओकेजन में या किसी इवेंट में जाते हैं, वहां पे अगर लाउड साउंड है, अगर है, वहां से आपको बचने की जरूरत है। अगर आप ऐसे जाते हैं तो कान में कॉटन लगा लें, या बहुत सारे ईयर प्लग्स आते हैं, वो ईयर प्लग्स का भी यूज करें। और वो लोग जो लाउड साउंड क्रिएट करते हैं, स्पेशली शादी में इतने फटाके वगैरह जलाते हैं, उससे नॉइस पोल्यूशन होता है, और उससे जो सुनने की जो समस्या होती है वो परमानेंट होती है, उसका क्योर नहीं है। उसका फिर हमारे पास एक ही ऑप्शन बचता है, जिसे हम हियरिंग एड बोलते हैं, कान की मशीन बोलते हैं। तो बहुत सारे, जैसे कि आप, बहुत सारे ऐसे लोग हैं जो हियरिंग एड लगाना नहीं चाहते हैं या अपनी वो ईयर की ट्रीटमेंट लेना नहीं चाहते हैं, उनके लिए ये प्रॉब्लम और भी ज्यादा हो जाती है। तो आप बिल्कुल किसी फंक्शन को अटेंड करें, किसी इवेंट को अटेंड करें, लेकिन वहां पे मैं उन लोगों से भी रिक्वेस्ट करना चाहूंगा जो लोग शादी वगैरह जो अटेंड करते हैं, या शादी वगैरह जो लाइक जो उस तरह की जो हाई नॉइज देते हैं, वैसे लोग को नॉइज देने की जरूरत नहीं है। So here I am stopping the audio. So I like as I already told you that the main motto of making this video was to create awareness, or you can say spread awareness among general public regarding noise induced hearing loss. So I hope this video, this audio will be beneficial for the people who regularly who regularly attend pubs or DJ or some kind of events and function where they are getting exposed with high intensity of sound. So it's always better to protect our ears, especially our outer ear cells, because it's something gift by the nature, and it's very limited in number, and it's like something which we can't generate also. Like basically our ear consists almost 12 to 14,000 of outer ear cells, and it's always better to protect them from any kind of unwanted sound or noise or any kind of thing. Okay, see you in the next video.